Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about the telehealth changes coming October 1st, 2025. The clock is ticking. Medicare's telehealth flexibilities expire after September 30th, 2025. And I'm doing this video a few weeks before it actually takes place. I highly doubt the government will make any changes or extensions at this point. So I'm doing this video now to hopefully give you enough awareness and time to make any pivots that you need to before this changes October 1st, 2025. The current telehealth practices or flexibilities, majority of them have been extended because they were enacted during the pandemic to allow people to have visits to their provider virtually because they weren't wanting patients to go into medical facilities due to the increased volume of patients that were ill. They didn't want people to be exposed to things to become ill if they were healthy, yada, yada. We all know the story. And so it's just been since 2020 that these telehealth guidelines we're following right now have been adopted by a lot of practices. I have been saying for probably about a year and a half now, if you've been watching my channel, that I have been encouraging people not to open telehealth only practices, unless of course you're in a few specialties where it's allowed, specifically behavioral health is fine. I have been saying that if you rely a lot on telehealth in your practice, that you should be preparing for the changes that are going to ultimately be coming. So hopefully you've taken my advice because, as I've said, October 1st looks like they're going to be reverting back to the old requirements for telehealth prior to the pandemic. If you weren't in medicine at that time, maybe you don't remember what it was because you didn't practice telehealth. We're going to talk about today what most specialties are going to be reverting back to when it comes to telehealth requirements in order to provide those services per CMS guidelines. Remember, this is all per CMS guidelines. Every insurance has different telehealth guidelines right now. If they follow Medicare, then they're probably going to revert back as of October 1st. If they don't follow Medicare, then they might still allow telehealth. But you need to go into each of the payers that you bill, the in-network contracted payers that you participate with, and you need to do your own due diligence and find out if any changes are coming, whether it's going to be October 1st, which is the beginning of the fiscal year for the government. That's why it changes for CMS. Or if they're going to be implementing changes coming January 1st, 2026. That is a possibility as well. If you can't find anything on the websites right now for the other payers, you need to regularly be checking to make sure you stay on top of this. I would hate for any of you to be offering telehealth services at any point to any patients and come to find out that you're not able to bill them and you lose that money. You have to stay on top of this or delegate someone internally to stay on top of this for you. I am not going to be able to provide every payer's guidelines when it comes to telehealth. I'm just going to give you CMS and then you will have to do your own due diligence, okay? So the current extensions are for the COVID era flexibilities, but they end September 30th, with the exception of end-stage renal disease, ESRD, dialysis visits. Those aren't going to change. They will still be able to do telehealth. And then, of course, we have permanent rules for behavioral health as well to continue the telehealth. The one thing that will be changing for mental health, I know for sure, is that patients are going to need to be seen within 6 months of their first telehealth visit, like face-to-face visit within 6 months, which has not been enforced over the last few years, but it's going to change October 1st. And they're going to have to be seen in person at least once a year after that. So if you're in behavioral health, mental health, you do have some changes coming. So I encourage you to also look up and see if there's anything else, okay? Same with if you offer end-stage renal disease, home dialysis type things, I would encourage you to look this up as well. The other exceptions that will stay are acute stroke diagnosis treatment will still be able to be done via telehealth. That's the third one. So we have end-stage renal disease, home dialysis visits, acute stroke diagnosis and treatment, and mental health, behavioral health, including SUD. Telehealth from home is not going to change, okay? Because we have permanent rules already for those that have been changed in the last few years. We're going to be reverting back to pre-pandemic guidelines, and this is what is really important, and I want you to make note of this and understand this, okay? Because chances are, if you work in a busy metropolitan area, you are not going to be able to provide telehealth for just any specialty except for the ones I just talked about, okay? Geographical limits return. So patients must be in a rural or health professional shortage area, an HPSA. You would know if you're in an HPSA, you would know if your patients are coming from a rural or HPSA per the definitions of CMS, I promise you. So if you're questioning that, most likely it's probably not qualifying. If you're not sure, again, never hurts to look it up. The originating site restrictions. Patients are going to have to be physically present in an approved originating site or facility. That's a clinic, a hospital, a skilled nursing facility. The home is no longer an eligible site for them to be taking or conducting their visits with these healthcare professionals, except for, of course, dialysis and behavioral health, like we talked about. The eligible providers are very narrowed now. Only physicians, nurse practitioners, physician assistants, certain clinical nurse specialists, and specific facility types may bill for this, assuming they have patients that qualify that live rural or in a healthcare shortage area and go to an approved originating site. Okay, there's a lot of boxes here you have to check. Other professionals, PT, OT, SLP, lose telehealth reimbursement unless Congress extends them. Again, we're like 3 weeks out. They have called a late audible before. I don't see that happening this time, but I said that last time, so we're going to have to watch closely, okay? The teaching physician rules tighten. Virtual supervision no longer counts. And physicians must be in person for resident supervision outside limited scenarios, okay? These are really, really important and things that you need to be educating your staff about. You need to update your scheduling for this. You need to tell your providers about this because, again, October 1st, if you start billing out like you have been for telehealth to Medicare, they're going to get denied. Permanent policy changes for 2025. Audio-only allowances remain only where specifically permitted. Behavioral health, opioid treatment, things like that. Teaching physician flexibilities are extended through the end of December 2025, but they're expected to expire. So that teaching physician rules tightening with the virtual supervision, that is good through the end of the year. So if that is something that you guys practice, at least you have a few extra months to get that all figured out. And certain new codes like caregiver training, PREP counseling, etc. remain temporarily approved, I think, through 2025. And we should, again, have more final rules released in Q4, October, November, for any of these that are going to expire at the end of the year to see if they'll have more permanent rules for them beginning in 2026. We are expecting to hopefully have some new telehealth service codes in 2026, so we'll have to look for the final rule. And then the permanent removal of frequency limits, higher facility fees, and direct supervision allowed virtually. Some of those other things I talked about that are ending at the end of 2025 or October 1st of 2025. We're hoping some of those get changed, but it does not look like right now they're going to be making changes to the originating site and the type of providers that are going to not be able to provide telehealth. So those are done October 1st, and that's the biggest thing I want to get out there to you guys. The place of service 10 that you probably use for conducting a telehealth at a patient's home for telehealth ends September 30th. Unless there's some last minute audible, like I said, from CMS, you're not going to be able to bill place of service 10. Place of service 2, patient in a telehealth facility. Of course, that would still be something that you would want to use if the patient qualifies for telehealth because of what we talked about earlier, and they go to a telehealth approved facility to accept that telehealth visit with you if you're a qualified provider who can offer telehealth, okay? And you'll want to use the MLN telehealth booklet for calendar year 2025 as a billing reference. I will put a link to that in the video description for you because it will talk about all of that. So some planning recommendations that I have for you. You need to look and see how many patients are regularly utilizing telehealth in your practice and notify them that they aren't going to be able to utilize telehealth if they don't qualify per everything we talked about starting October 1st. If you have patients scheduled after September 30th for telehealth and you don't qualify, you need to call those patients and get them scheduled for face-to-face with you in the office. Again, this is for Medicare only patients, Medicare Part B. If you checked their insurance online and they are still going to accept telehealth the way it is right now because you're billing Blue Cross or Cigna or something like that, then you can keep it. But a lot of those follow Medicare guidelines, okay? So just be sure that you guys are paying attention to that. Communicate to patients early. Submit comments by September 15th, 2025 for the proposed 2026 rules that have to do with the physician supervising and the frequency limit returns and the reimbursement, stuff like that. You can make comments, but I don't think they're accepting comments necessarily about the originating site and the type of providers, but it never hurts if it lets you do it, of course. And you want to stay alert for potential congressional extensions. Again, I don't see that happening because we're getting so close, but if they do, that would be beneficial, but I wouldn't assume, and I would be prepared if I were you, if you're not going to qualify per these old new standards that are coming for telehealth. So we're heading back to the pre-pandemic rules. Geography matters again. The home doesn't count as an originating site for patients. They have to go to a clinic to do it. Download the CMS guide, review your billing workflows and who's scheduled for telehealth after September 30th, and be prepared for these changes coming October 1st, 2025. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video is helpful. Subscribe to my channel if you haven't already. And as always, please share this with your colleagues whom would benefit. This is very important information and I want to get the word out. Thank you so much for the support, and we will see you next time. Bye-bye.